Welcome to Velocity, the Vista Chamber Podcast. I'm your host, Chamber CEO Rachel Beld, and it's my privilege to interview the movers, shakers, and change makers impacting our amazing community and beyond. My guest today is Dr. Jean Ma, President and CEO of Tri-City Medical Center. Dr. Ma attended medical school at UC San Francisco, completed his internship at Stanford, and his residency in emergency medicine at UC San Diego. He joined Tri-City's emergency medical group in 2000 and spent more than 2 decades caring for patients in the ER while also serving as chair of emergency medicine and later chief of staff. Along the way, he was named San Diego's top doctor in emergency medicine 10 times. In addition to his clinical work, Dr. Ma founded Work Partners Occupational Health Services and has held leadership roles in healthcare startups and private equity. Today, he leads Tri-City Medical Center as president and CEO. And when he's not at the hospital, he's busy with his wife, his high school sweetheart, their 5 daughters, and their very loved King Charles Cavalier. Welcome, Dr. Ma. I'm so glad to have you.
Thank you for having me today, Rachel.
Of course.
It's always a pleasure to speak with you.
Thank you.
Yeah.
It's always nice to see you and
Yes.
and I'm excited today to learn a little bit more about you. We've worked together for a number of years.
Yes.
But I'm excited
Yes.
to just learn more about you and what's going on at Tri-City. So
Yeah.
let's just dig right in.
Yeah, my wife was so excited I was coming to see you today. She said, please tell Rachel hi. I love
Oh,
Rachel.
that's so
There's-
nice. Thank you.
Yeah.
Your whole family is just wonderful. So thank you so much. So to get started, I want to learn a little bit more about you as a human.
Okay.
So tell me about growing up. Did you always know that you would have a career in medicine?
Yeah, absolutely not. I was lost as a kid,
Mm-hmm.
much more into sports, finding trouble with my brother. So yeah, we grew up, my dad was a State Department, so we traveled a lot. We were in other countries for the first 12 years of my life. We actually didn't come back to the United States until I was 12. So yeah, very all over the place, really directionless, I guess. But I didn't know I was going to go into medicine until much later.
So what sparked that interest for you?
I think everybody has their own personal story. My mom suffered a ruptured aneurysm when she was really young, when I was really pretty young. And so, seeing how that changed our lives, her life, and the impact that the medical community had on our entire family's lives. My dad changed jobs. It really, it was very, very meaningful to have those relationships with providers. And I think that kind of sparked that interest, but I still didn't know that was what I was going to do until later.
Yeah.
Yeah.
How old were you when that happened?
I was 13.
Oh, wow.
Yeah.
So a very important time in your life. And so obviously
Yeah,
very
very
significant.
formative
Yes.
years, just kind of coming back, forming new friends in junior high, which is brutal.
Yes, absolutely. Mhm.
So, and then to have that,
Yeah.
so it was tough, but it was, like I said, very impactful on all of my brother and my sister in our lives.
Yeah, absolutely. Absolutely. So then when do you think there was a specific time? Was it in college when you were taking coursework? When did you actually decide, okay,
Yeah.
I'm going to be a doctor?
Yeah, I think I started taking classes in, I think one of the things I wish that, and I think it's gotten better, but I wish I would have had more of an exposure to different careers. Now, you get to see so many different inspiring people and what they do. I think growing up, I felt like we knew doctor, teacher, police officer, these are the common themes we all kind of knew, but we didn't know how many opportunities there were. I wish I would have had exposure to more. But so I knew, well, I was a decent student in high school, not great. And during college, I started taking some classes thinking, okay, well, maybe, if I do okay, maybe that pathway of helping people is actually something that could open up for me. And and ended up, the more I started taking classes, the more I really enjoyed what the sciences could offer. Then just with the long-term horizon, the sciences, I knew that wasn't gonna be my passion, but the opportunity to work with people was something that I really, really thought heavily about. And as I got to got to volunteer and see what the medical profession could be for me, progressively I had more and more interest, and then it became clear.
Wow, great. It's so true what you mentioned about exposure to careers and opportunities. And
Yeah,
that's one of the areas that the Vista Chamber, we've really been leaning into, working with our school district and providing opportunities for students, which is why we have our Velocity Summer Internship Program, which allows students to be paid for summer experiences with different companies. So I do
that's
agree
amazing.
that students today have way more opportunities, but we could do even more. So
Yeah.
I'm glad that you mentioned that. I'm curious about how you specifically chose emergency medicine, because that seems that it would be very stressful and very challenging. And so I'm curious if that was your first choice. How did that work out?
Yeah, um, I think I grew up at a time when we were starting to get exposed to, TV shows and
Did you love ER?
yeah, I actually did.
I love
I
that
did.
show so much. I loved it so
Yeah,
much.
I
Yeah.
did. I did. And it's great to see Noah Wiley back.
Yes.
But I think part of it is that my natural tendency has always been to, and that's kind of the joke about ER doctors. Other doctors see us as jack of all trades, but master of none.
Okay.
But I took pride in that. I always wanted that when I wanted for friends to come up to me and be able to help to at least direct them,
Mm-hmm.
and to have an understanding of what they're talking about. And almost any subject in medicine,
Yeah.
you're exposed to in emergency medicine. So I liked that aspect of it. Um, and I didn't want to be so specialized that I didn't know anything about the rest of medicine. And
Okay.
ER, you never know what's going to come through the door. So you really do have to have that specialized training to be equipped to handle anything.
Yeah.
So I enjoyed that. And the second part of it is I'm very mechanical. I'm very hands-on. My time away, my therapy is, working with my dirt bikes and fixing my cars. And, so those are the kinds of, and ER is very procedural, very mechanical in some ways.
Mm-hmm.
The reality of it is medicine is largely much more, thought-based. It's decision-making.
Mm-hmm.
And so when we have people volunteer or shadow me, I think they see the TV shows and it's constant action. Well, it's not. Most of what's going on is actually decision making, and so
Mm-hmm.
it's a little boring in that way.
Yeah.
So,
Okay. Okay.
yeah.
I'm curious, for our listeners who also love DR, do you have a story that you could share? Something interesting, something memorable that stuck with you during your time, specifically in emergency medicine? A story that you can share that wouldn't violate HIPAA.
Gosh, people always ask me that. What's the worst thing you've ever seen?
I don't know if I want to hear about the
You know what?
worst. I think just something
And some of
memorable.
my stories
Yeah.
are pretty. They're often pretty poignant.
Yeah.
And because those things that stick with you, right?
Right.
And there are things that I wouldn't be able to share some of my memories that really
Yeah.
stick with me.
Yeah.
One of the things I remember, first and foremost, I would say it's people forget that the senses, it's not just vision, it's the other senses that stick with you. It's the smells,
Mm-hmm.
it's and the emotions. I remember the most devastating moment for me was when he was a young dad. He was young, and he essentially had a cardiac event at home on Christmas Eve.
Mm-hmm.
He was brought in, and it was already by that point he had been. It was going to be very difficult to resuscitate. His heart had long stopped, but he was young. We were going to give every effort. And I remember the wife coming in and telling me, tomorrow's supposed to be the best day of the year. And I'm going to wake up and tell my kid, they're going to wake up and this is what I'm going to tell them. And I just thought,
Mm-hmm.
this is just so wrong. And
Yeah.
it's just those emotions, they stay with you. And they're the toughest part about emergency medicine is those emotions are so raw. They're so real. They're unfiltered. And people share with you, their greatest vulnerabilities, their greatest worries,
Mm-hmm.
and you don't have an answer for all of them, and you can't save everybody, much as you want to. And when it doesn't happen, it devastates you. It
Mm-hmm.
really does, especially younger. Not that as we get older, it's okay. It's everybody has a story, and when you hear their stories, And it's so personal. It's really, really hard. I think those are the biggest ones. Got all kinds of different, crazy events that I can remember. One thing I will just share is one time, and I think I shared this with my kids, is that one time a young person came in just dirty, greasy, burn marks all over their face, just black, brown grease all over. And what happened? And the person was hallucinating, and they had
Oh,
been on
goodness.
drugs.
Mm-hmm.
And later, when we gave him some medications, and over time he recovered, and he had thought that the he was underneath a vehicle and licking the motor, the transmission that was still hot, and burned his face. That's all the grease. And he thought it was ice cream. And so he was licking it and said,
Oh,
oh my God.
gosh. Do not do drugs.
So my kids are like, oh, okay, we're not doing drugs.
Do not do drugs. Yeah.
Yeah.
Wow.
Yeah. So
That is,
there's lots of,
wow.
every ER doc will have all kinds of
I'm
interesting
sure.
stories. Yeah.
Yeah. Okay. Well, thank you for
Yeah.
sharing a couple of those. You made a transition into being the CEO of Tri-City. So tell me
Yeah.
about, I mean, you were already in leadership. You were the chief medical officer.
That's right. Yeah. Yeah.
But tell me about kind of that transition from chief medical officer to CEO, maybe the difference in that role. What does that mean? And why did you decide to do that?
Yeah. It was never what I thought would be where I would end up. I
Mhm.
never thought I would end up administrative. I really loved the clinical side of it. I always thought that's where I'd be. I saw myself as an emergency physician. My youngest daughter jokes now when I say I'm a doctor. She says, you're not a real doctor.
Aw. Why do
She's
our
just
kids have to
trying
be so mean? They know how to just
They
dig
really know how
in.
to get at you.
Yeah.
Yeah. But no, I think I really, when the position came open, we had a wonderful CEO who had done an amazing job getting through the hospital through some of the most difficult years, Steve. And it was really challenging in the hospital, coming out of COVID. It was difficult for a lot of hospitals, and Tri-City was no different. You could see the toll it takes on people, because when they really care, and this is a community hospital, it's a district community hospital. We're there for everybody. We're there for you. You work there. You could choose to work anywhere, but you work there because you feel like you have a purpose
Mhm.
and a role in serving your community. And so it really is personal. I think for me, at first I really didn't see myself in the role, and I actually didn't apply for the position to start. And one of the board members later, fair enough, said, well, you didn't even want this position. Why are you now stepping into the role? And for me, it was really understanding whether or not the board was ready to take a significant step forward,
Mhm.
and have the willingness to grapple with the challenges of the future, and honestly have the humility to say, yes, I'm publicly elected, but if there's a better path forward for this community and this hospital to ensure the stability and growth, and bringing additional services and expanding what we can do here for our residents of this community, I'm willing to turn that over to a certain degree, at least on the daily operational side of the hospital. And when it became clear to me that we had 7 board members that really were aligned in that purpose, and that their role on the board was not their identity. They were there because they wanted to see the hospital in a better place, and they were willing to make whatever sacrifice it would take to get this organization there. I thought, we have an opportunity. We have an opportunity and a point in time. And if I'm the right person, yeah, I certainly had the imposter syndrome. I had led medical groups. I had, but I didn't have hospital CEO experience. But I really felt like we had a shared common purpose at that point in time, and we had unfinished work to do. And so that really kind of made me decide that if they were willing to give me that chance, then and they felt like after a national search I was the right person, then great, let's do it. And so the transition has been, it's been gradual, most definitely. Going into the chief medical officer role, moving into that administrative side, gave me a view into the hospital at that
Mhm.
point in time. It's definitely been a big transition since that time, but I love it. and I'm really grateful for the board for having given me that opportunity. They took a chance with somebody who had never been a hospital CEO. And I'm grateful for that opportunity because I'm proud of the things that we've done together because we have so many people that share that same sense of purpose and share that same desire to see this organization really be here for the community for the future in much bigger and better ways.
So since you've been CEO, there's been a lot of transition. There's been a lot of change, but there's been some really great moments to celebrate. So I want to ask you about some of those celebrations and some of the things the accomplishments and awards that the hospital has won in the last few years, because there's so many.
There are, and thanks for asking that, Rachel. I think it's hard as a district hospital. We're very cautious not to. We don't spend a ton on marketing, and
Right.
that's our own fault. I mean, you do have to tell your story, and I think the ability to tell Tri-City's story is so important today, given where we're going and the impact it can have on its community. Because sometimes people don't know the impact it has on the community. And so there have been some really big wins. Some of the biggest wins, of course, is the financial position of the hospital, right? 3 years ago, I think we were very much a very distressed hospital on the verge of bankruptcy. And we're really, really struggling at that point in time. Significant debt in the form of accounts payables, little reserve, little bit of cash left. And the organization had seen erosion in market share over many, many years. And so fast forward now, we're running at 25 consecutive months now of positive EBITDA, 15 consecutive months of positive EROE. We're cash flowing. Our cash reserves are significantly better. Our debt is significantly paid down, and we have very little debt. And so the future is very bright. And I think that's also something that allowed us to open the partnership that we have coming with Sharp, because Tri-City is a jewel. It really is. And that's what Sharp has said to us. We're really proud of the opportunity to become part of Tri-City because it's truly a jewel. We want to enhance what you have here. And some of the things that have occurred just in the last 4 months, Tri-City, and again, this is something that people don't recognize. It's always been a place where people seek the care for their emergency care, right? In that moment of need. But it's really spectacular when it comes to heart attack and stroke care. And that's our people are wonderful at that. And we've been an innovator, a pioneer. The first stroke treatment which was TPA, which is the standard of care today, was delivered at Tri-City.
Wow.
Many firsts occurred at Tri-City, but people don't know that. And what people don't know today is that legacy in emergency care carried over to the point where just this year, only one hospital in San Diego County achieved the American Heart Association's highest level of performance for both stroke and heart attack care, gold or higher. And so only one hospital achieved for both stroke and heart attack care. And I would venture to guess that if you asked anybody, we'll give you a guess as to which hospital that would be in San Diego County, they would not guess Tri-City. And these aren't awards we can purchase. They're not marketing dollars.
Right.
They're simply outcomes-based. Who does the best?
It's incredible. Congratulations.
Yeah, we're really excited about that, and also an award that came with, in addition, only one hospital achieved gold in San Diego County for resuscitation medicine, and that again was Tri-City.
Wow.
And it really speaks to, in your moment of need, and again, I don't know that the community knows this, that the resources for that emergency level of care, it really, I know we speak in hyperbole sometimes, but in Southern California, you'd be hard pressed to find a better hospital when it comes to a heart attack or stroke.
Yeah.
Yeah, and there's so many other things that we do, but I hope that's not my phone. I apologize. But yeah, so.
Yeah. When you're having an emergency, when your life is on the line,
Yep.
it's important to know where you should go. And in most cases, it's get to the closest place that can help you, right?
Yes. Yes.
But when you talk about Tri-City being a district hospital and spending money on marketing and things like that, you're putting money into care, you're putting money into services and into programs that help people. And so I'm glad you're here today so we can tell more people, my mom and the other 3 people who are listening, about these amazing services and about the amazing awards that you win and that you will continue to win because of the incredible care that people get at Tri-City. Tell me about, you hosted a ribbon cutting recently. Tell me about that piece, about that exciting news.
Yeah, I think emergency care is so critical to our region. We certainly need all the hospitals to be a healthy community, and emergency care is so critical. And in that moment of need, uh, we're going to need Tri-City to be there and be there stronger than ever. And what we have recently done with the gracious and very generous donations made by the Previs and Copley Foundations through the great work of our hospital foundation and that board, they were able to support a redesign of our emergency room. And the redesign is really important because the ER was built in pods, and that's not the way we operate emergency rooms today. The reality of it is 40% or more of people actually are walking. They don't actually need a bed. But data shows nationally that when you get into a bed, things slow down for one reason or another. But if you're constantly moving and you remain ambulatory, the throughput is significantly faster. So most hospitals are now creating team triages or ambulatory platforms where we're able to service the needs of those patients a lot faster by keeping them going, and the dedicated resources to move those patients. We had pods, which were really not structurally engineered to align with the operational engineering that was necessary to be efficient to deliver that care. And that's what this did, is to redesign our lobby, redesign team triage, build out a team triage area, and what we call Pod A, but it's now opened into one pod to be able to service ambulatory patients. Because you don't have to be extremely sick to need an emergency room still.
Right.
A lot of people still need an emergency room. They may have, let's say, diverticulitis, because if that doesn't get taken care of today, that could perforate. And that could result in a critical emergency. So those are the kinds of things that people say, I can't wait right now. I may be able to walk, and it hurts to walk, but I can walk. And I don't want a bed. I just want service faster, and I want a diagnosis, and I want to be taken care of. I want my treatments, and I want to leave.
Yeah.
And that's what we want to do, is to meet people where they want their care. And so the grand opening, or the ribbon cutting, was the reopening of the redesigned emergency room that will enhance the flow. Because one of the biggest criticisms, and completely own it and be cognizant of the reality, is that one of the biggest criticisms of Tri-City over the years has been, perceived and often lengthy waits in the emergency room. We've dramatically changed that. I think if you ask any hospital today, most hospitals will tell you still that they will hold patients in the emergency room waiting for beds upstairs. And that's what actually blocks many of the ER beds. Tri-City has solved that problem. We now our wait for a bed upstairs is on average 4 hours. But you will often, most patients that have recently been in a hospital ER waiting for a bed will tell you, I had to wait 12, 16 longer hours to go upstairs to a bed, inpatient bed. That is not the issue at Tri-City anymore. But we want to solve the second part of the equation, is throughput in the emergency department. And that's what we're so excited to do, because our commitment is to ensure that our community knows when they need us, we're going to be there for them, but be there in an expeditious manner that respects their time.
Wow, that's great. It's so interesting to hear the details of that, because when I think the average person hears the emergency department was remodeled or redesigned, they may be thinking, oh, it's an old building. This is cosmetic. This is about aesthetics. But really, it's about the functionality and the throughput of the patients and making it a more efficient and an effective space for
Right.
people to get the care that they need and to move through that
Exactly.
process. So thank you so much for explaining
Yeah.
that, because I think so many people don't necessarily. I've been hearing honestly about the redesign of the emergency department, and I knew it would improve. Sorry, I knew that it would improve
Yeah.
the flow, but to that detail, I didn't understand. So thank you for sharing that with me and for the folks that are listening. That's really important and critical.
Oh, yeah. Thanks for letting me share that.
Of course. Of course. So you alluded to it before, but I want to hear about this new partnership. This new partnership that
Yeah.
will
Yeah.
impact Tri-City Medical Center for decades. So tell me about what's happening.
Yeah. And I want to, kind of a disclaimer is that I'm taking this on my lunchtime because everything that I say as a public employee, now that we're in
Yes.
the campaign window, if I'm on the clock, so to speak, it has to be information only. And I really do want to be factual and share information only. But
Got it.
I want to be clear that because I sometimes am very passionate about what's happening here,
Mm-hmm.
it may lean towards a little bias. And so I do just to be safe, I take my lunch break during these types of
Sure.
events, or I do it after
Well,
hours.
it is the noon hour.
It is a
So
noon
we're
hour.
at
Exactly.
lunch.
Yep.
Okay.
So,
So
but yeah, so this partnership there's an allowance in the health and safety code that allows a district hospital to transfer its assets to another entity, another healthcare entity. And this is something that when I talked about what was the board looking for, was I the right fit? This is what I was looking for. It was my belief that healthcare has significantly changed. And there are challenges that are going to be very, very difficult to overcome as a single entity hospital. And it's always been that case, but it's only getting worse,
Mhm.
right? And things change at the blink of an eye in healthcare. Just federal policy just this year. I think none of us were prepared. We weren't able to budget for any of this. That's coming, and it's hard to absorb as a single entity hospital. And when you can't absorb it, it impacts. It impacts so many aspects of what you do. And so it's really important to have resources, support, um, more centralized services, and the economies of scale that allow you to focus on delivering great patient care. Um, and so the fact is that this is a lease that needs to be approved by the voters. And so it will come to the voters. It's ballot measure H in this coming election on June the 2nd. The definitive agreements, we went through 6 public meetings, shared the definitive agreements online. There were literally the red lines. And we took public comment, our board did, and solicited the feedback of the community. Say, what do you want? What are you looking for? And access to high quality emergency care was so important. And that is, again, our focus. But this is going to not only enhance that, not only preserve it, but enhance it, because Sharp does such a phenomenal job with emergency medical care. Grossmont is a perfect example. It's a district hospital that they entered into the same lease in is that my other phone?
I don't know.
In
No, we're good.
1991. A 30-year lease. By 2014, and it's the same thing, a 30-year lease, all the assets go over to Sharp. They take all of the debt and the liabilities, and the district says, we're just asking you to be good stewards. Be good stewards, take care of the hospital, invest in the hospital. The commitment is $100+ million. In fact, it's going to be significantly more, but that's just the initial investment. And show us that you can be a good steward of this organization and this community. And only one health system had done that, and that was Sharp. They did it with Grossmont, and Coronado's actually a city hospital that's leased. And they've done it with Chula Vista. And they've been committed to those communities, and they grow in those communities. And they just, as an example, built the neuroscience hospital in Grossmont, in that La Mesa area.
Wow.
Because that's where they realize the care needs to be delivered. It doesn't have to move to say the mothership in, wherever it may be. And so what we saw was they were willing to invest in the community where that care needs to be delivered. And that's what we were looking for. Now, if in 30 years, the community says, we don't like this, all the assets go back to the district. The district actually still has title to it in 30 years. But for 30 years, it's long enough to say, Sharp, can you make the investments? Because if it was a 5-year, would you make that
No.
investment? Probably not.
No.
But 30 years, absolutely. And what we saw in 2014 was that community said, absolutely not. Of course we will support a renewed lease. Absolutely not will we allow Sharp to leave. We see the tremendous value in what they've done because that hospital and that community is thriving today compared to what it was in 1991. We really believe that given their history of committing to communities and delivering care in those communities, they'll often tell me, that Sharp is not for profit, but for people. And, taglines are interesting and you wait to see, is that real? The Sharp experience, is it real? Everything I've seen, we delivered all, my wife delivered. I kind of was present.
You were there.
She did all the work, delivered all 5 of our children at Mary Birch because the Sharp experience isn't a tagline. It's a culture. It's who they are. And that means a lot to us as an organization because that's critical to Tri-City's future. We want a culture that really values people and patients and is committed to that. And so this partnership is a 30-year lease in which if the voters approve that on June 2nd, it is not a tax. It is not a bond measure, but simply an authorization by the voters required by the law to say, yes, we think Sharp is the right entity and we trust Sharp to take management control and operate the hospital for us. And so far, I think almost universally, we have, knock on wood at this point, no opposition. Everybody has agreed. And through our public meetings, every comment was 100% favorable with regards to the affiliation. So there were a couple of comments that were not related to the affiliation, but everything related to the affiliation and all the feedback we've gotten has been so favorable. I would say the only negative comment we've got, if I could categorize it as negative, was why can't you make it happen any faster? And it is the law. It just requires a vote. So if it happens, if the vote is approved on June 2nd, then around July 1, we expect July 1, again, if we're fortunate enough to have the voters agree and say, yeah, this is a good thing for the community. This is a huge community benefit. And Sharp is making a massive investment to preserve and protect local healthcare, increase access to care, protect emergency care, expand emergency access to care, and make investments in the infrastructure for the future. What's the downside to this?
Right.
And I think everybody we've talked to 100% agrees.
Yeah, absolutely. Thank you for sharing that. And it's so important for folks to understand what's on the ballot measure. Sometimes it can be confusing. People might think that there's a tax associated with it or that all the employees will be fired and new people will come in. There's a lot of rumors that get started.
They do.
And
really
so
do.
it's very nice to hear that if you are someone who you get your care at Tri-City Medical Center, you're going to go there, you're going to see the same faces, you're going to see the same employees, but maybe new services or improved services. So it sounds like a really great opportunity. So it's Measure H for hospital.
Right.
And, the Vista Chamber of Commerce is supporting this measure. We are absolutely thrilled to see this investment in Tri-City Medical Center. We have a long history of partnership with the hospital and the district. And we know that as an economic development tool, that when businesses want to move here and bring companies here and jobs, we need to have quality healthcare in order to attract and keep businesses, talent, and to help families grow here. So I'm really glad to hear that this is moving forward, that it will be on the June ballot, and we want to help you get the word out about it. Is there anything else that people need to know, or that questions that might have come up, dispel any rumors, anything related to this affiliation or this ballot measure?
Yeah, no, I think first and foremost that people ask is, is there a tax? Because everything's going to be taxed these days. No, the investment's being made by Sharp. This is not a tax or a bond measure. The other thing is, yes, all the employees are going to be retained by Sharp in this new Sharp hospital. It will be a Sharp hospital. if the voters approve that. And the other thing that I think is important to know is that there are plans already underway. We, as you know, and I think this is one of my biggest regrets in the role that I've, because this is very personal. This is my community too. It's my hospital. One of the first things that I take responsibility for is 3 years ago, we ended up closing labor and delivery and women's and newborn services. That's a very personal mission for me and this community because we are seeing labor and delivery units close throughout the country. Since Tri-City closed labor and delivery, 2 more labor and delivery units in this county alone closed. But we're telling a very different story today. And the opportunity with Sharp is not just to rebirth labor and delivery at Tri-City. The opportunity is to bring something significantly greater than it was before. We had fantastic people. We've always had fantastic people, but it's the resources around it and the idea of Sharp Mary Birch coming to North County and the expertise that Sharp Mary Birch brings. I would argue the preeminent brand in women's health. We're really excited and we are making plans to do so. Our goal, we like to say, our goal is to deliver our first baby at Tri-City in this calendar year. That's a lofty goal. I don't know that we're fully ready to commit to that because there are a lot of outside influences that could delay that, but that's our goal. And it just shows me that Sharp is so committed to doing right by the community because, the finances are such that they're not, you wouldn't choose a for-profit. This is why I think our board wanted a not-for-profit. A for-profit probably wouldn't choose labor and delivery to be the first thing to be the
ROI
priority.
isn't there.
It is not.
Right.
Yeah. And that is why many of them are closing today.
Yeah.
But Sharp is committed to the community and the people it serves and the needs of the community. And that's and there's a very, very big need for maternal medicine, but not just maternal medicine, which we had, but advanced maternal medicine, maternal fetal medicine, those with high risk delivery, being able to serve that perinatology and maternal fetal medicine. Those are areas that are lacking in North County. The other thing that's lacking, and people will often, when you need high-end oncology care, cancer care, many of our residents today you may get the consultation in North County, but the care is being delivered south in La Jolla or south. And we think that's for this is an amazing community and continues to grow. The largest population of senior growth in all of San Diego County. We deserve to have top-notch cancer level care here in North County. And
Absolutely.
That's the other thing that Sharp desires to build with Tri-City is to mobilize our medical office building that is now fully titled to Tri-City. You've seen that building in the front, brand new shell space. But the goal is to build a really world-class cancer center with Sharp here so that our residents are not seeking care and driving on a freeway to get care for an hour, 3 times a week for chemotherapy or whatever it may be.
Yeah, that's brutal. Yeah. Thank you. Wow, that's incredible. So many amazing opportunities on the horizon for healthcare in North County thanks to this partnership with Sharp and Tri-City. And it all comes down to the voters in June, Measure H. Wow. Thank you for sharing about all of that.
Yeah, absolutely.
Is there anything we didn't talk about today that you'd love to say? Anything that we missed?
Yeah, I think the last thing I would say is the one thing I'll hear is sometimes people will say, well, I'm with X insurance or I'm with the X hospital. But what people don't realize is, again, well, I think they do realize in an emergency, you're going to go to the closest hospital. And 30 minutes on the freeway is the difference between permanent stroke disability versus full recovery. And the other thing is, what people may not know is Tri-City, because of our very high-end services, like thrombectomy care, we are a thrombectomy capable center. One of probably, I would argue, the data would suggest one of the very first in the county to be delivering thrombectomy care, which is when you have a stroke, you get treatment with the medication, but basically like liquid plumber.
Okay.
if you're not a candidate, there's only a small window of hours that you can get that. If you're outside of that window, in many hospitals, that's it. That's all that can be offered. At Tri-City, we have the technicians, not plumbers, but technicians, but they're like plumbers, but for the body, and they actually feed a tiny wire through your groin into the brain, into the channels of all the arteries, and basically scoop out the clot, even well
Wow.
up to 24 hours later. Now that's an extreme circumstance, but the window is significantly larger, and that's the difference between disability and having a very normal life. And that happens I would say almost every day at Tri-City. So there's a significant difference in somebody's life that's occurring as a result. But we are the thrombectomy center for many of for other regional hospitals. And so while you may get your care here, the closest center for some of the high-end care can often be at Tri-City. So you never know when you need those services, but the important thing to know is, as you said, it's so important for any thriving community to have great health care. And we just want to be a piece of that, and Sharp is going to be able to really make that so much more robust at Tri-City. We're really excited about that future.
That's awesome. Dr. Ma, thank you so much for your leadership. This,
Thank you.
solving North County's healthcare challenges is a big undertaking, and you have just your experience and everything that you've done at Tri-City, turning a big red line into a black line, and helping to find this partnership and work through, I'm sure, hours and hours and hours and hours of working on these contracts and negotiations. And I know you're not the only one, but thank you for everything that is happening for our community because of your leadership and because you're willing to take a chance. Like you said, you didn't ask to be a hospital administrator necessarily. You love medicine, but this is really, your impact is going to last for decades. So thank you so much for your leadership.
Thank you that's very nice of you to say. It is definitely a team, but it's an honor to be able to serve in the position that I'm in and work with a board that sees the future and shares that same passion. And with a community and leadership like yours, I really am really excited about what we can do together.
Yeah, thank you. Thank you so much. So before we wrap up our conversation, I always ask every one of my guests a few rapid fire questions.
Sure.
So my first question for you
Yeah.
is, give me a book recommendation. Tell me a book that you love.
So most of the books I've read recently probably are not books that you can just sink into. What I will always go back to is just recently my kids and my the things that are impactful. Books, I think that's where you create that connection,
Mm-hmm.
and that have meaning to you. My mom, when she passed away, my mom really literally was the giving tree that Shel Silverstein
Mm-hmm.
book, and that was her. And I gave all of the cousins a copy of that book, and because they all knew that was my mom. After she had her stroke, her aneurysm, she became just the kind of person that cared nothing about anything else in life but her family, and nothing else mattered to her. And she gave and gave and gave until there was nothing left. And I
Mm-hmm.
always felt that was my mom. And so that, and then I think the Giving Tree, and I'm blanking on my kids. Oh my gosh. Goodnight Moon.
Mm-hmm.
I remember reading that to my kids all the time, and I've just been thinking about my kids a lot lately,
Yeah.
as they're getting older. But those ones are impactful. So
Yeah.
I'm sorry, I don't have a great recommendation for
That is a great
a recent book.
recommendation. I
Yeah,
love to hear,
yeah,
because like you said, books are so personal and so
yes, exactly.
impactful.
Yeah,
So it could be something you read when you were 5 or something that you read yesterday,
yeah.
and it can impact you in a different way. And
Probably not the answer you're looking for, though.
and it's so interesting. No, it's great. It's actually really interesting to me that your mom had a traumatic incident with this aneurysm.
Yeah.
I assume that's in the brain. Yes.
Yes. Mm-hmm.
And now you're at a facility that is renowned for the care that you give people when they have a stroke or a brain incident. So that has to be such an incredible feeling to know that you did take that piece and now you're impacting, you said, someone almost every day
Yeah.
with this type of care. So
Yeah.
that's incredible. That's incredible.
Thanks.
That's getting me teared up. Okay, so my next question for you.
Yeah.
What's your jam, Dr. Ma? What's a song that you love?
People I always people don't they look at me like, what? I'm a Raiders fan. People
Okay.
are like, that's wrong.
Okay.
That is so wrong.
All right. I wouldn't have guessed that, but all right.
I love country music.
Okay.
And people are like, what?
Also a surprise. Yes, thank you. Cool.
So, I think if I'm thinking of, Megan Maroney is probably
newer
on top
artist.
of my playlist these days,
Okay.
right? And, songs like Tennessee Orange, I think they're just so real.
Mm-hmm.
There's something that's just so real about them. They tell real stories of
Talking about family and community and connection.
Yeah.
Okay.
Yeah. And I think that's, and one other song I would say that really strikes me. I was just listening to the other day, and it's like, I don't listen to it very often, but it's musical theater, and that has such an impact on me too. I love musical theater. And
who doesn't love a show tune?
And Wicked's For Good. I remember my kids singing it together. Oh, that'll
get you in the feels.
The impact of people who come into your lives, and and that's really what it's all about.
Yeah.
Right? So that one really kind of always, whenever I hear that, you think about the people that have made an impact in your life.
Yeah, absolutely. That you've been changed
Yeah.
for the better and for good.
That's right.
Absolutely.
You're the best. I love it.
So tell me, what's something that inspires you?
Well, I think genuine people inspire me. People that do it not because it's a job, not because they're paid to do it, not because they're told to do it, not because it's the right thing to say or they're supposed to do, because they love what they do, and they're authentic, and they're passionate about it. When I see people like that, and I'm surrounded by really great people who love what they do, and I get to work with, like you. You're very authentic. You're very sincere. You love what you do, and I can tell. And you're great at what you do.
No, thank you.
People like you that are serving a purpose in their life, in a community, and will look back, in their moment, in their rocking chair, and say, I did good. I did good in my life. I served a purpose, and I think watching people that really, whether it's in the military, whether it's in public service, whether it's at a hospital, that genuinely love what they do, and they do it because for all the right, good reasons. Those are people that always inspire me to say, you can do better. You need to do better, and I hope people one day will, at some point will say, yeah, you did okay there. I'd like to be like one of those people.
Mm-hmm.
But that's who inspires me. That's what inspires me.
Yeah.
Yeah.
That's great. And I think that people already say that about you. So it's just, it will be continue to be said. Okay. My last question for you is, tell me a Vista business that you think deserves a shout out.
So, gosh, I'm blanking on the name of the restaurant. So I'm going to skip to the one of my first experiences when I moved here was, these blueberry donut. They were
blueberry cake donuts from Danny's Donuts.
Yes.
They're nationally known. They are.
People, and I didn't know. And I was like, oh yeah, that's in Vista. You should go. I'm like, oh my gosh, yes. And I've gone several times to go pick up, just to pick up.
They're delicious.
They're delicious. Yeah.
It's so dangerous. They're actually right outside our front door here.
Yes.
So if we go out the front door and around the fence, there's Danny's Donuts where you can get those blueberry cake donuts.
Oh my goodness. Yeah.
They're delicious, dangerous.
They are. Absolutely.
I'm sure there's
wonderful.
zero calories and 100% healthy.
That's
but
what I tell myself.
They have fruit in them.
Yeah,
and
I'm a
fruit.
doctor, so.
Yes. Dr. Ma says.
Well, as my kid says, you're not a real doctor anyway.
Oh, that's so mean. Dr. Ma, thank you for spending time with me today on your lunch break. I really appreciate it.
Yeah, thanks.
It's so nice
thanks for having me, Rachel.
Yes, nice to get to know you a little bit more and to hear more about all of the exciting things happening for Sharp and for Tri-City. So thank you so much for joining me.
Thank you.
Thank you to our guest, Dr. Jean Ma, and thank you for listening to Velocity. If you like what you heard, please subscribe and tell a friend. Help us move Vista forward with Velocity. The Vista Chamber of Commerce is a nonprofit organization that serves as a catalyst for business growth. Find us online at vistachamber.org.